I'm Dr. Peter McCullough, and I'm an internist and cardiologist and professor of medicine at Texas A&M University School of Medicine. I'm on the Baylor Dallas campus, and I've been integrally involved in the response to COVID-19. I'm an academic doctor. I see patients, but I'm very involved in research. I'm an editor of 2 major journals in my field. I'm the most published person in my field, which deals with the heart and the kidneys in the world in history. People under 50 who fundamentally have no health risks, there's no scientific rationale for them to ever become vaccinated. There's no scientific rationale. One of the mistakes I heard today as a rationale for vaccination is asymptomatic spread, and I want you to be very clear about this. My opinion is there is a low degree, if any, of asymptomatic spread. Sick person gives it to sick person. The Chinese have published a study, British Medical Journal, 11 million people. They're trying to find asymptomatic spread. You can't find it. And that's been, one of important pieces of misinformation. What has gone on has been beyond belief. How many of you have turned on a local news station or a national cable news station and ever gotten an update on treatment at home? How many of you have ever gotten a single word about what to do when you get handed the diagnosis of COVID-19? No wonder. That is a complete and total failure at every level. There's not a single media doctor on TV who's ever treated a COVID patient. Not a single one. What happened in around May, it became known that the virus was going to be amenable to a vaccine. All efforts on treatment were dropped. The National Institutes of Health actually had a multi-drug program. They dropped it after 20 patients, said we can't find the patients. The most disingenuous announcement of all time. And then Warp Speed went full tilt for vaccine development. And there was a silencing of any information on treatment. Any. Silencing. Scrubbed from Twitter, YouTube. Can't get papers published on this. We can't even get information out in our own medical literature on this. There's been a complete scrubbing.